Good afternoon, one and all. Welcome back to my health and fitness channel. Yesterday I was speaking in Facebook Live and I saw a lot of buzz about COVID vaccination. I've also answered a few queries yesterday, but I thought I'll make a full episode on COVID vaccine updates December 2020 today. So I've jotted down some of the queries as questions. So I will be reading each question and then trying to answer them one by one. The first question was, is there different types of COVID vaccine available in Indian market? So the answer is yes, because there are 2 or 3 laboratories in conjunction with companies like AstraZeneca where they are producing vaccination. Also there is a vaccine company called as Bharat Biotech in Hyderabad which is indigenously developing this COVID vaccine. So these vaccines are having different mechanisms to work with. So yes, there will be different vaccines available in the market and it depends on where you are staying and the state government which vaccine they are going to procure. So now India, first they want to give to all the health workers, nurses, doctors and paramedical staff. This is roughly about 1 crore Indians. Then they want to start vaccinating people above 50 years of age. Then they will start vaccinating people below 50 years who have morbidities such as blood pressure, diabetes, obesity or chronic illnesses such as cancer. Post this, they will be coming to the general public. From whatever newspaper reports I saw, Indian government has procured about 500 million doses from AstraZeneca/Serum Institute of India. They're also procuring 1 billion doses from an American company called as Novavax and 100 million doses from Sputnik, which is a Russian-based vaccine. So altogether, this comes to 160 crore doses. As you all know, each vaccine has to be given twice with 4 weeks apart. So if we have 160 crore vaccines available, we can give this vaccine to 80 crore Indians. And the same 80 crore Indians have to take the next set of vaccines after 1 month. So is there any difference in their action? So these vaccines, although there is a bit of difference in the mechanism of action, the ultimate goal, which is reducing hospitalization of COVID vaccinated people, this is showing near 100% results in all of the trials of all the vaccines. What I am trying to say here is, if someone gets the vaccine and develops the immunity, the chances of him or her needing hospitalization, even if they were to contract COVID-19, becomes remote, which means large number of lives can be saved. So the mechanism of action may differ, but all of them are very efficacious. So if we get a chance to get any of the vaccine, regardless of the company, we should go out and get ourselves vaccinated. When are we getting the vaccine? So by the reports from the Indian government, looks like January they will be starting to give the vaccine to the healthcare personnel, and February, March it will be rolling out to the general public. So can children and pregnant ladies be given the vaccine? So currently all the vaccine trials are being done on adult population who are healthy and above 18 years of age. The trials have showed very good results with minimal side effects. However, the vaccine trials have not been done on either pregnant ladies or breastfeeding mothers or on children. So the data there is not yet out there. So probably once the adult vaccination begins, they may also start giving to some volunteer pregnant ladies, and then if that results are good, then it will be rolled on to the pregnant ladies. Also 12 to 18-year-old children may start getting included as volunteers, and once it is successful in them, then it might go on to come to the all other children. So I have again answered this question, can breastfeeding mothers take the vaccine? Currently, we do not have the data to support whether breastfeeding women can take or not. So currently this vaccine will not be available for the breastfeeding mothers. If we have already got COVID-19 disease, do we still need to take the vaccine? The answer is yes. Whatever data we have from the last 9 to 10 months, there are reports to suggest some people who have got the COVID-19 disease might have not developed sufficient antibodies and there was a possibility of reinfection. Although the correct data is not fully clear, probably some more studies are required to get a correct picture of this. So in these difficult times, I think it is prudent for us, even though we have got COVID-19 disease, to get the vaccination to ensure adequate antibody levels. What are the side effects of the vaccine? I have seen a lot of WhatsApp images being circulated about the side effects. So let me take this opportunity to reiterate this point. All the vaccines are using either a killed coronavirus or parts of the protein which are taken from the coronavirus. Either the killed virus or the particles itself cannot cause coronavirus in us. So in that regard, these vaccines are safe. They definitely, whether it will work or not, it cannot give COVID-19 disease to us. This is the first point. Like any other vaccine, these vaccines also will have side effects such as pain in the site of the injection, some swelling perhaps, redness. In some individuals, there may be some fever with chills, myalgia, which means body pains, headache. But most symptoms of post-vaccination last for 24 to 48 hours. Simple paracetamol, which is freely available in the market, is good enough to deal with these symptoms. We have not noticed any major allergic reactions with this vaccine. So my take is we should not worry too much about the side effects, and if we get a chance to take the vaccine, we should go out there and take the vaccine. Once we are vaccinated, how long does it take to get the immunity? So this vaccine is given, as I have said before, in 2 doses. The first dose is given and then after 4 weeks the second dose is given. By 10 to 14 days, antibody levels are detectable in the body, and by 4 weeks good antibody levels are detected, which means to say 4 weeks after the first dose, a person is reasonably immune to COVID-19 disease. However, I have said before, these vaccines are preventing near 100% of hospitalization. But if the efficacy is 90%, it also means 10 out of every 100 can still get milder version of COVID-19 disease. They may experience some slight fever, some cold, cough, body pains, like any other cold virus which comes during winter seasons. And it may have a small course lasting for 3 to 5 days and resolve, but it will not be life-threatening. After vaccination, can we freely move all over India without masks? The answer is no. I have told you 10 out of 100 can still get mild versions of COVID-19 disease even after taking the vaccine. So if they are not using hand hygiene, masks, sanitization or washing their hands frequently, there is a chance that they will be the spreaders of this virus to people surrounding them. So wherever they go, they should still continue to use their masks and follow strict hand hygiene protocols. How long will the immunity to this vaccine last? So again, The vaccine has been just tested in the market for 3 or 4 months, so long-term data is not available. Most scientists out there are speculating that the antibody levels will be maintained for at least 12 months, but some of the scientists out there are clearly telling minimum 6 months there will be a definite maintained antibody levels. So again, we need to watch this space after another 3 to 6 months to see the first batch of volunteers who will cross 6 months and recheck their antibody levels to see how the levels are maintaining. So I think these are some of the questions I have tried to answer. If there are any further questions, please write back to me and I'll try to answer them back. Thank you so much for watching. Have a good day.